So how long do you think that new filling your dentist just put in your mouth should last? Leave me your answers in the comments below and let's talk about it in today's video. Well, hello again folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods and I'm a retired dentist from the state of South Carolina here in the US. So I realize it's been a little while since my last video. I took a little break, but I hope to get back into the swing of things starting now. You know, when I was practicing, my patients would often ask me how long a filling or crown would last and if it would ever have to be replaced. Some patients were genuinely shocked to hear that their restorations would not last their entire lifetime. Well, I'm here to tell you that dental restorations definitely have a finite longevity, depending on factors related to both the patient and the doctor doing the procedure. Now, what are some of these determining factors? I'm glad you asked. Number one, the competency of the dentist doing the procedure. I think this is pretty self-explanatory. The more skilled the dentist, the longer the restoration should last. Number two, the financial orientation of the practice. So what do I mean by this? Well, does your dentist always recommend the best procedures using the best materials, or are they okay with patching things up with cheaper materials? Just saying. Number three, the type of dental materials used. Well, I just mentioned that earlier. Number four, the way the materials are placed. Many materials require absolute dryness for them to work properly. You might remember your dentist putting this square piece of latex rubber over your mouth while they work. This is to prevent your saliva and tongue from wetting the tooth being restored. Not using this rubber dam, as it is called, can open up the chance that your filling won't last as long. Number five, the quality of the finished restoration. Is the border between the restoration and your tooth nice and tight and very smooth, or are there openings and gaps that can let food and bacteria in underneath that restoration? Number six, the age of the patient. Now, I'm not trying to be funny here, but a filling placed in a 90-year-old will likely last their entire lifetime. That same filling on a 20-year-old, well, not so much. Number seven, the patient's diet. Are they always drinking sugary sodas and snacking on candy bars, or do they eat healthier snacks such as fruits and vegetables? And number eight, the patient's hygiene. Are they meticulous when it comes to brushing and flossing or not? And are they using cavity-preventing materials such as fluoride or not? As you can see, there's a lot of things going on simultaneously that can have a huge impact on the life of that filling. The dentist is certainly responsible for their part, but once the patient leaves that dental office, it's up to them to take proper care of that filling or restoration. All right, well, let's talk about the different types of restorations and their typical life expectancies. Up first are composite restorations. Those are the tooth-colored fillings, not the silver ones. As pretty as these fillings can be, we're looking at a range of 6 to 14 years on average, depending on the size of the restoration. The bigger they are, the shorter they'll last. On to silver amalgam fillings. Despite the controversy swirling around these fillings, and you can check out an earlier video I made about that controversy here, these fillings are still in use by about 60% of US general dentists, at least some of the time. Here the range of longevity is from 14 to 17 years. Let's talk about removable partial dentures. These devices replace several missing teeth at the same time. Patients don't love them, but sometimes it's the only choice we have. Now, these can be made out of plastic or metal. For the metal-containing partials, we're looking at a longevity of about 14 years. Again, shorter for the plastic ones. For full dentures, 12 years is the average lifespan. Let's move on to crowns or caps. Full gold crowns were extremely popular in the past. Your grandparents might have some gold crowns or fillings in their mouths. Today, people are more concerned with cosmetics, so gold is looked down on. But the lifespan of these gold fillings and crowns is somewhere between 27 to 40 years. Yeah, that's right. Now, porcelain crowns with a metal base have been around for many decades. They look a lot better than the gold crowns, but most patients still don't like the idea of any metal in their mouths. So this type of restoration is being performed less and less. Expect these crowns to last 20 years on average. Finally, we come to the metal-free crowns, commonly referred to as zirconia crowns. They're very popular now and comprise the vast majority of crowns placed in the US. The aesthetics of this material keeps improving along with the strength, but because they're relatively new, it's difficult to say exactly how long they will last. Estimates of 17 years on average are mentioned, but they're only estimates and are likely inaccurate. Folks, dental restorations have a finite lifetime. I don't know if you detected a trend here, but did you notice that the restorations containing metal, although certainly not the prettiest, lasted the longest? Clearly, this is something that you'll need to discuss with your dentist. Go in with realistic expectations. Do your absolute best to take care of your oral hygiene at home. Keep up with all your cleaning appointments in the office, and you should be able to enjoy whichever restoration you decide to go with. Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well. Please consider subscribing and be sure to hit that bell icon so you can be notified of future videos on dentistry made simple. Bye-bye.